Good evening. My name is Wajeeha Sahar. I am PhD Health Science student from Department of Allied Health Science in Lincoln University College, Malaysia. I am presenting in second International Brain and Biomedicine Conference, which is organized by Department of Physiology in Government College University, Faisalabad. The topic of my presentation is comparative effect of segmental breathing technique versus conventional treatment for improvement of dyspnea after beating heart surgery patient. First of all, beating heart surgery is a complex procedure in which surgeon uses a portion of healthy vessels from legs to create a bypass around a clogged artery. In this surgery, without cardiopulmonary bypass, surgeon operates the heart while heart is beating during operation. Adequate preoperative respiratory muscle training strengthening may help to protect development of postoperative pulmonary complications. Coronary artery disease is a common type of heart disease that occur when the blood vessels supplying the heart muscles or coronary arteries become narrowed or blocked, leading to reduced blood flow to the heart. Indications: patient with coronary artery disease who require coronary artery bypass grafting, individual with multiple coronary artery blockages or complex anatomy where traditional CABG may be challenging. Patients who are at high risk for complication from using a heart-lung machine, such as those with certain medical conditions or advanced age. Segmental breathing techniques involve focusing on specific segment or areas of lung during breathing exercises. The technique typically include the following steps: diaphragmatic breathing. Inhale deeply through your nose, exhale slowly through pursed lips, feeling your abdomen fall. Segmental focus: once comfortable with diaphragmatic breathing, focus on specific segment of your lungs. You can divide your lungs into upper, middle, and lower segments. Benefits of exercises is to improve lung capacity, is to enhance ventilation, is to induce relaxation and reduce the stress, and to gain respiratory muscle strengthening. Conventional treatment: pain management, effective pain control is essential post-surgery to minimize discomfort during breathing and promote deep breathing exercises. This includes incentive spirometry and deep breathing exercise to improve lungs function and expand lungs capacity. Early ambulation is to encourage patient to start moving and walking as soon as possible after surgery, can help prevent pulmonary complications like atelectasis and pleural effusion, and it improves overall respiratory function. Oxygen therapy is provide supplementary oxygen if needed to improve oxygenation and relieve dyspnea and to maintain oxygen saturation of patient. Cardiac rehabilitation also included in conventional treatment, in which patient participates in a structured cardiac rehabilitation program. It can improve cardiovascular fitness, it reduces dyspnea and enhance overall recovery after heart surgery. Literature review: coronary artery bypass graft are vascular graft made to bridge the obstruction in the coronary blood vessels. Saphenous veins from legs are placed accessing the heart by median sternotomy. Pulmonary dysfunction and associated complications are major cause of morbidity and mortality in period following beating heart surgery. Inspiratory muscle training is a course of therapy consists of series of breathing and segmental breathing exercise that aims at increasing ventilation, preventing postopulmonary complications, and eliminate the useless uncoordinated pattern and decrease the work of breathing. Postopulmonary complication occurred in 7.82% of patients with coronary artery revascularization. Several types of complications such as acute respiratory distress syndrome occurred in 3.35%, pneumonia in 2.79%, atelectasis in 3.35%, pleural effusion in 2.22%, and pneumothorax in 0.55%, and they all are major factor for increasing mortality rate. This research was conducted by Eli et al. In 2012. Rationale of study is to in which patients who receive preoperative conventional physiotherapy when undergoes beating heart surgery are usually at risk of post-op poor pulmonary health. So this study is to conduct to investigate the effectiveness of segmental breathing technique versus conventional treatment for improvement of dyspnea after beating heart surgery patient. Significance of studies to provide evidence-based treatment to patient for finding treatment option to improve post-op pulmonary health. In patient undergoing beating heart surgery, result of study may be applied for improving post-operative pulmonary health. Methodology: study design is prospective randomized control trial. Study setting is National Hospital, Lahore, Pakistan. Statistical analysis: SPSS version 20 used and independent sample t-test are applied. The duration of study is 4 months, and sample size was 60, which is divided into two groups, Group A and Group B. Each group contains 30 patients. Random sampling technique was used and sample was allocated to Group A and B using the lottery method. Inclusion criteria: patients who are willing to participate in the study, both male or female patients were included, all participants within the age group of 40 to 65 years, patient with 2 or 3 vessels involvement. Exclusion criteria: study participants who showed inconsistency with initial stages of exercise rehabilitation, patient on steroid or bronchodilator and with neurological disability, which is affecting on respiratory rate and left ventricular ejection fraction less than 40%, and concomitant valve disease, patient having dysrhythmia or pacemaker dependent, pregnant female, and obesity according to BMI, patient having asthma, COPD, and interstitial lungs disease were excluded. Result of study was duration of mechanical ventilation were improved in interventional group. As p-value showed, it was 0.01001 as significant result was shown. Oxygen therapy duration, interventional group, the value is 54.2 and as p-value showed 0.001. As it showed significant result, oxygen therapy duration was short in interventional group as compared to conventional or control group. Length of ICU stay was reduced in interventional group as p-value shown its significant result 0.001. Discussion: current study shows that there is difference among the duration of mechanical ventilation, oxygen therapy, and ICU stay of interventional and control group, while the result of E.I. Badawi et al. 2017 showed that segmental breathing pulls oxygen into the deepest lobe of lungs, enhancing delivery of oxygen and nutrients to tissue and removes carbon dioxide. Current study showed that there is difference among the duration of mechanical ventilation, oxygen therapy duration, and ICU stay in both groups, showed a significant reduction in length of stay in the coronary care unit in study group. Current study showed that there is difference among the duration of mechanical ventilation, oxygen therapy duration. As study was conducted, Leonardi et al. In 2019 showed that inspiratory muscle training in routine care was not resulted in decreased ventilation in study and control group. Conclusion: the segmental breathing exercise appears to be an effective intervention for reducing dyspnea and improving respiratory outcomes in beating heart surgery patients compared to conventional treatment. Further research is warranted to explore the long-term benefits and mechanism underlying these findings. It is an essential component to reduce the incidence of reintubation, chest tube reinsertion, but also improve the benefits on healthcare resources as well. These are the references. Thank you.